to this session of Administrator Issues and Updates on September 23rd, 2025. County Administrator Gary Schmidt, would you please call the roll for us?
Yes, Chair, thank you. Roll call. Commissioner West.
Here.
Commissioner Schrader.
Here.
Commissioner Helm.
Here.
Commissioner Savas.
Present.
Chair Roberts.
Here. All right, Gary, would you please introduce the first agenda?
Thank you.
item
Yes.
for us,
First
sir?
item today is Jail Opioid Disorder Treatment Grant Application. The title is Approval of a Grant Application with the Oregon Criminal Justice Commission for Jail-Based Medications for Opioid Use Disorders. The application value is $257,129.66 for 2 years. Funding is through the Oregon Criminal Justice Commission. No county general funds are involved. This is a new item, and as promised, we bring it to you first at issues. If you have any questions or concerns, and then it moves to a consent agenda request. Please come forward, Captain Jennifer Freeman from the Sheriff's Office and Lieutenant Brian Emdike, who will give you a 1-minute, 2-minute brief introduction of what the topic is and then answer your questions. Welcome, Captain Freeman and Lieutenant Emdike.
Good morning, Chair Roberts and Commissioners. My name is Captain Jennifer Freeman, and I serve as the Jail Commander for the Clackamas County Sheriff's Office. With me today is Lieutenant Brian Emdike. Lieutenant Emdike manages both our Transition Center and our Residential Services Substance Abuse Program. We're both here to respectively request your approval for us to apply for this grant with the Oregon Criminal Justice Commission for jail-based medications for opioid use disorders. If we were awarded these funds, our Transition Center would be able to significantly enhance and streamline access to treatment for individuals with opioid use disorder within the Clackamas County Jail. These resources would allow us to contract with a qualified provider to supply a certified alcohol and drug counselor, also known as a CADC. This service is currently unavailable within the Sheriff's Office. The addition of a contracted CADC would fill a critical gap by enabling us to offer jail-based counseling tailored specifically for adults in custody who are struggling with opioid addiction. The presence of a CADC would provide more than just individual counseling sessions. It would create an opportunity to complete professional assessments, develop individualized treatment plans, and connect participants to evidence-based practices proven to reduce the cycle of addiction and criminal behavior. By having the CADC, we would be able to not only provide therapeutic interventions to those in custody, but we would also be able to transition participants directly to treatment in the community upon their release. These services would address the alarmingly high rates of substance use, relapse, and overdose that disproportionately affect justice-involved individuals. Thank you for your consideration on expanding these important treatment options for these justice-involved individuals.
All right, thank you. Anything else before I move on? Commissioner Savas, it was questions from my colleagues. Go ahead.
Yeah, so thank you for the presentation. I'm trying to we currently administer, or we have professionals administer that today, right?
What was the question?
Opioid treatment in the jail?
Oh, yes.
We
Yes.
do that currently.
Yes, we do.
So, and there's a doctor that prescribes that, right? I mean, drugs have to be prescribed by a
Yes.
doctor, correct?
Yes.
Okay. So is this simply not more staffing? It's literally just additive as to trying to defray the cost? Or can you tell me exactly how the monies are being used with the existing system in place today?
So this would add the CADC counselor. We don't currently have one for actual counseling for the adults in custody. And so that's what we're trying to do, is get a form of counseling so it's not just the medication.
So is it a part-time position? Because it doesn't seem like $257,000 will go very far if it's a trained, licensed counselor.
It would cover for the 2 years.
Okay. Okay.
We researched it through behavioral health.
All right, thank you.
Any other questions? Well, I'm going to take this opportunity and brag about the two of you for just a moment. And I've really had the opportunity to work with both these individuals for years. And really where these two individuals are at is really not only leading the state, but a large part of the country in Medicaid-assisted treatment, early intervention. Brian's been a leader at the CSAP program. And I just would, maybe, Brian, if you could just talk a little bit about the CSAP program and kind of where we're at and kind of our success. I love hearing about it all the time, so.
Yes, of course. So our CSAP program down in Milwaukee, it's very unique because we treat individuals with opioid use disorder, and also we address their criminality. So we need this both. We're searching for this high-risk criminal addict, and we focus on the criminality more so than the addiction, although we address both. And It's full-service treatment, so we deal with the whole individual. Our clients spend roughly 12 months living with us, and then another 6 months in the community with continuing care. So it's essentially, we take people from jail in custody suffering from addiction, and we get them back onto the street, self-sufficient, working, housed, and living in the community.
Great. One of the other questions I kind of had for you too is the kind of the lower level offenders. You kind of focus on those high-risk offenders and how we're doing on maybe addressing those lower-risk offenders. And I know Commissioner West has been kind of leading the charge on the recovery campus, and wanted to kind of know, could those individuals perhaps be seen at the future recovery campus?
Correct. This grant, what we're trying with this position, would also help with the lower-risk people, because we could identify those people in custody and get them into the services they need. We have CSAP for our high-risk people, but this will help with getting the assessments done while they're in custody so we can place them directly into services.
And Commissioner West has a comment.
Yeah, I've been paying close attention and had many conversations with your medical staff in depth around medical assisted treatment and how we do it. The sheriff's office and you all have been incredibly evidence-based and cutting-edge in your approach. It is resources like this that allow individuals to be more successful as they get those wraparound services and those behavioral health counseling resources necessary, especially as they start to become more stabilized and go through the recovery process. And these medications allow them to do that safely and then turn this more into a managed chronic disease and then something that, will rob them of life and the ability to be stable in community. So you guys have done a great job. I'm fully supporting this today, and I'm really proud of the work that you guys have done at the county. And thank you for the long clinical conversations about how this is delivered. And we are trying to do the best we can and be innovative to address the crisis head on. So thank you for that work. And I totally support this.
Thank you.
Commissioner Savas has a
Yeah, just another question. Is this a contracted counselor, or is this an FTE?
No, it's a contracted.
Okay, because I was thrown off a little bit where it said we currently do not employ, so it just kind of drew the question. So it's a contracted,
It'd be
right?
contracted.
Great, thank you.
All right, you two. Well, thank you very much. I appreciate you presenting today. So if there's no other questions or concerns, this will be put on the consent agenda for October 2nd, our business meeting. And as always, keep up the great work, and thank you.
Thank you for your kind words.
Thank you.
Gary, what is next?
Thank you. Next is Suicide Prevention Month presentation. September is Suicide Prevention Month. This was scheduled for your business meeting last Thursday, but because of the time, we rescheduled it to today. Presenters are Mary Rumbaugh and Gally Murray from Health, Housing, and Human Services. Go ahead, please.
Good morning, Chair Roberts and Commissioners. Thanks for having us today to just talk briefly about a topic that impacts far too many in our community, including within my own family. So September is Suicide Prevention Awareness Month. It's a time to raise awareness, promote hope, and normalize help seeking. Suicide remains a common and yet largely preventable cause of death and continues to be an important issue for Health, Housing, and Human Services. Clackamas County's rate has been on a trajectory of steady increase for over the last decade, and most suicide deaths continue to be individuals 45 to 64 years old, and the majority of suicide deaths are men. The work of suicide prevention is life-saving. It's actually required in statute through some of our grants that we receive, and yet it is terribly underfunded and yet so vitally important to save lives. So the month of September is dedicated to recognizing the warning signs for suicide, encouraging open conversations about mental health, and connecting people to supports and services. So I am going to turn it over to Gally Murray, our Suicide Prevention Coordinator with H3S. He's going to walk us through the presentation.
Thanks, Mary. Administrator Schmidt and Chair Roberts, Commissioners, good morning. My name is Gally Murray, and I'm the Suicide Prevention Coordinator with the Mental Health Promotion and Suicide Prevention Team within Public Health, within H3S. That's a mouthful. And as Mary said, September is Suicide Prevention Awareness Month, and I'm pleased to be here this morning to talk with you about the work that we're doing. Whenever we talk about suicide prevention or message about suicide in general, we always want to offer resources for folks. So for folks who might be in the room, for folks who might be watching virtually, a reminder that support is available, that if folks are struggling, we really want people to reach out. There's help. So included on this slide is the 988 National Crisis Line, Youth Line for our young adults, and then last but not least, our amazing colleagues at the Clackamas County Crisis and Support Team, and that number is 24/7. So I'm going to give you all a very high-level overview of what our program does, the Mental Health Promotion and Suicide Prevention Program, what it looks like, how we do it, why we do it. So the Mental Health Promotion and Suicide Prevention Program promotes mental health literacy and works to prevent suicide through community-level interventions and education. We provide free suicide prevention trainings to individuals and community-based organizations, creating a widespread safety net for those at risk in our community. We provide technical support and consultation to our own county departments and community-based organizations who wish to become more intentional in their efforts around suicide prevention. We distribute secure storage items such as pistol vaults and medication lockboxes to prevent misuse of medications and unauthorized use of firearms. And we provide a wide variety of resources and supports following a death by suicide in our community. This is also known as postvention. We do this work through collaboration with other partners and champions, and through changing systems that reduce stigma and norms around suicide and mental health. Next slide, please. So our program does this work because our suicide rate in this county is higher than the national rate of suicide and has been that way for quite some time. Over half of all suicides in this county were individuals 50 years and older. 57% of all suicides in this county are individuals 50 and older, and that is not a fact that is well known. So I just want to emphasize that 57% of all the suicides in this county are individuals 50 and higher. Men make up the majority of those deaths, and over 60% of suicides in this county are via firearm. Next slide, please. We do this work because our rate in this county has been on a steady trajectory of increase for over 20 years. And it's unacceptable. This graph is the visual of what that looks like. And although we've had some decreases, as long as there are continued deaths in this county by suicide, we do not have reason to celebrate wholeheartedly. Next slide, please. Okay.
If it was more interactive, this would have been a cleaner slide. Sorry about that.
Clerk, do you have the slide deck that I just sent you, by chance? And that might give, rather than a blur of all of your faces, all of the information on the slide, it might give us a little bit better opportunity. Yeah. So what our efforts look like are what's going to be on the slide here. And what we do to combat these rates that I've talked about is through our prevention efforts and our other efforts. And what we know about prevention is that it's oftentimes very subtle, it's oftentimes seemingly invisible, and it's oftentimes very hard to measure the effectiveness of prevention. And I'm here to tell you that prevention is all around you, all around me. It makes a huge difference in this community, and it saves lives, without a doubt. Thank you, Clerk, appreciate it very much. So one click. So our work, perfect timing, thank you. Our work engages our community in conversations about mental health and suicide prevention and encourages them to take action and start conversations. We will be walking once again as a Clackamas County team of community members and employees in American Foundation for Suicide Prevention's annual Suicide Prevention Awareness Walk on October 4th. And we would welcome you and yours to join us. Dogs can come as well. Next slide, please. Our program increases mental health literacy and suicide prevention awareness in our community by infusing hope and connection through messaging and free suicide prevention trainings to the community. In 2023, we provided training for close to 1,200 individuals in our community. 72% of those participants reported that they had used information, skills, or resources that they had gained from taking a class, which they might not have done had they not taken the training. And again, these trainings are free. Our Coalition to Prevent Suicide, which is a community-driven group of individuals and professionals within this community that is wanting to be more intentional about the work of suicide prevention, partnered with Clackamas Education Service District and created a smartphone app called Compass to Connection, and you'll see the logo here on the slide. This smartphone app will serve as a toolkit for youth and young adults, parents, and caregivers who are seeking to learn more about support options available to young people in this county, how to navigate conversations about mental health and suicide, and much, much more. For those of you who have Apple phones, I would encourage you to go to the App Store and download Compass to Connection today. For folks who are watching, I would encourage you to do that as well. This app is live. And for those of you with Androids, you'll have to wait just a little bit longer. We're working on it. Next click, please. Our program also partners with our school districts. Andrew, you have a tough job right now. I appreciate you. Thank you. Our program also partners with our school districts. Thank you. And with youth to train young adults in a suicide prevention training called QPR, or Question, Persuade, and Refer. And this training better identifies when peers might be struggling and what to do about it, and when to get a trusted adult involved. In the last year and a half, our program has trained 11 high school students to become QPR trainers. Some of these youth are some of these youth are in this slide here, getting trained. These students have gone on to train staff and students in their schools and their district, creating additional youth and adults in our community who are trained to support individuals who might be struggling. Next click. From 2023 to July 1 of this year, our program has distributed close to 5,500 free secure storage items, such as pistol vaults, biometric safes, cable locks, medication lock boxes, into the homes of our community to prevent unauthorized use of firearms and misuse of medications, creating time and distance between someone who might be struggling and lethal means such as firearms or medication we know saves lives. So Andrew, if you could click one, two, and one more. An example of the power of prevention, again, oftentimes invisible or subtle, is right here. This quote from one of our amazing public health nurse home visiting case managers. This story, this person wrote, speaks to the real impact of staff training and the gun cases we provide as a team. A year ago, right after my staff training, I met with a client experiencing suicidal ideation. I offered her a biometric gun safe, and she said, "Yes, please. I've always worried I could get into the other case if I wanted to." Months later, she confirmed she was using it. And recently, during another home visit, she again disclosed thoughts of suicide and shared that she had considered using a gun, but couldn't access it because she had the biometric safe in use. She received intervention and is doing well today. The staff wrote, "What I thought was a one-time success has now become both a part one and a part two of this story, and I'm so thankful." Again, one of our amazing home visiting nurses, case managers. So this is an example of the power of prevention. This work truly makes a difference. It's life-saving, and we appreciate your continued support. Any questions or thoughts or feedback?
Well, it's lighting up like Christmas tree up here. Everybody would like to comment on
I
this.
love
So,
it.
Commissioner West, you're first.
I mean, I think your numbers for the county are similar across the entire nation, that demographic, that for some reason, men feel enough despair to the point to where they are taking their own lives at an alarming rate. And I think our county, unfortunately, is mirroring what we're seeing across the country in these stats. Caucasian white men and Native American men are the highest rates of suicide attempts. And I can't help but think that Oregon, for way too long, has really struggled with access to mental health treatment and care, and access to like getting to somebody to help you deal with the root causes that could lead you to the point of feeling like the only way out is taking your own life. So my first question is how do you feel like the county is doing when we look at like, we're always trying to improve and do better with the resources we have for the public to help this population and this number decrease, which is our goal here. How do you feel like over the last, 5 years, 3 years, have you seen treatment access to this population improve? Because at the end of the day, that's the root cause, is the mental health issue with those individuals. And so I would like to know about where we're making progress with access to care and treatment to help these individuals.
It's a great question, and I appreciate how much you know about this. I love when people are spouting statistics at me. It's great to know that you have all this information, so I appreciate that. I have to say, and I might punt it to Mary here in a minute, but I think, what we know is that people who die from suicide, not everyone has a mental health condition. So I want to be really clear about that. That sometimes, especially when it comes to access to lethal means like firearms and medications, we know that there's actually a national study that was done by Harvard, and basically they said that the average time of individuals who had thought about suicide and took action is typically less than an hour. So suicide is not always an impulsive decision, but it oftentimes is an impulsive decision. And so when we have access to firearms readily available, and for folks who are struggling, like maybe going through a divorce or a young person who's struggling, we're not asking for people to remove firearms from their home at all. We're just wanting to make sure that those firearms are not readily available to someone who might be actively struggling during that time. So a lot of it's around access to means, but I'll ask Mary to speak to the treatment.
Yeah, just quickly, one of the first slide where we now really market our 24/7 crisis line as our crisis and support line. We did that 5 years ago when we were just seeing an increase in folks calling the crisis line during the pandemic, struggling, and we realized we don't want you to be in crisis. We want you to know that support is available. The state also recognized through expansion of funding for mobile crisis response. So we've seen that. But Commissioner West, we lost a lot of this workforce during the pandemic. And so we haven't quite rebounded. But I think our message today, again, we're bringing a really heavy topic, and our message is a message of hope. Help is out there. The 24/7 lines, whether it's 988, our local line, any line, calling that, you are going to get immediate support. And that's what we're really asking people to do. And then we'll figure out how to break down the barriers to get you into ongoing treatment if in fact that is what you need.
Can I have a follow-up question?
Yeah.
So I know we have a huge emphasis on safe storage of firearms. I totally support that. I think it's over 50%, around 50% of the suicides that happen in the United States. I don't know if it's the same in our own county, are happening by firearm.
60% here in this county.
60% here. I know, I think nationally that number's in the 50 range. We look at Canada, they have much, much, much stricter gun control laws, but their suicide rates are about equal to the United States. And so people are still finding a way to get to commit that act one way or another. And so I'm not saying don't do what we're doing, because I think that you have a great story where that created distance and time between an individual. But I think I think we have to focus on treatment and root causes and getting in front of those people that are in that space and community, knowing who your neighbor is and what headspace your neighbor's in, and then not being afraid to intervene and to speak up and say something about someone you love or know, and being there and then helping guide that person through that crisis. We're all in this together. But so my thought is what other measures are we specifically taking to prevent suicide means and to distance them from those means, which I know is really hard beyond just firearms, because there is some evidence to our neighbors to the north that isn't necessarily dropping overall suicide rates, which is our goal.
No, it's a great question. And I I know you're talking about like access to mental health and how that's an important issue, and I'm going to take it even further, Commissioner. Like, we need in our county, in our state, in our nation, we need to create an environment where people don't need mental health care, right? So we need, this is upstream prevention work. So we're backing it up even more where people feel seen, they feel connected, they feel a sense of purpose, right? You're talking about, white men over 50 who are dying by suicide. Well, a lot of those folks are retired.
Yeah.
They don't have a sense of purpose. Sometimes they feel like they're a burden on their families. And so we know when people don't feel connected, when they don't feel seen, when they don't have a sense of purpose, the risk of suicide is very high. So I think, we could spend all day here, and I'd love to chat with you more in detail, but at the root cause of what suicide prevention really is connection. And if we can make people feel connected, so how are we bringing veterans together? How are we bringing people who experience chronic pain, which we know is a significant risk factor for suicide? How are we bringing those people together? How are we talking about mental health literacy? There are some communities in our county, folks, that don't want to talk about mental health because of the stigma is so significant.
And I would just add, the reason we actually moved Galli's position to public health, this is not mental health. This is a public health crisis. Every single one of us can ask the question, are you okay? Can I help you? This is an everyone problem. This is an everyone opportunity to solve. That's the reason we very purposefully are bringing the awareness really through public health and not making it, oh, you need to be a mental health clinician. Nope. We all can save lives.
I agree, and I'll end with this. I think that it's on all of us, like you said, Mary, to figure out what's in our culture that has caused this spike. What is it in our societal collective that has allowed this spike to happen and these deaths of despair to continue to grow within these populations? And we can talk about social media. We can talk about going down into the dark parts of the web. We can talk about feeling a burden on people, mental health issues. There's many things, but I do agree with you that this lack of community and connectiveness and conversations and dialogue and relating to one another and feeling like that you're part of something bigger than yourself
Absolutely.
has contributed to this. And it's going to be a lot of work to turn this, but we have to look in the mirror as a community and begin to change. So I appreciate this great representation, and thank you for answering my questions.
Yeah, thank you, Commissioner. And to the point about this work being really subtle and kind of almost invincible or almost invisible at times, it's like, steering a community culture change isn't something that is like very, very apparent, but it's very subtle, but it saves lives.
Yeah, thank you.
Yeah.
Commissioner Schrader.
Yeah, I recently learned, I think it was in the New York Times, of a very tragic death of a young person who was using artificial intelligence as a coach of how to commit suicide. So how are we addressing this new technology and how it can be abused, and actually how it can also, and I believe, I didn't pull up the article exactly, but I believe the parents are suing the AI companies. So are you educating youth about this? How are you coping with this new technology and how it can be abused?
Yeah, AI.
Yeah.
It's a great thing and it's not a good thing at all. So, what needs to happen in that situation, Commissioner, is AI, the folks who are running AI need, anytime there's a search for mental health or suicide, it needs to be a hard stop where the chat bot basically says, please call 988. Like, they need to not, Chat GPT cannot be a therapist. That's just not going to work, and it didn't work. And that is tragic. It's tragic. And so how we're educating our young people, this app that I talked about, Compass to Connection, is a direct result of our young people and our parents saying, we need more. We need more, and we need to go where our young people are going, and they're going, unfortunately, whether or not we like it or not, they're going to their phones. And so having something literally at their fingertips, and parents ask for this too, give me something so I can support. How do I have a conversation with my teenager about their mental health? I don't know where to start. And so this is a direct response to what our community has asked for. And I will also say that we spend a lot of time partnering with our schools. Our 10 school districts are doing an amazing job of supporting our young people. And quite frankly, in my opinion, there's a lot of effort, money, time going into our K through 12 population to support our schools around suicide prevention. And given the numbers that I just shared with you, we need to be pivoting a bit and putting time and energy and money into our older adult population. Because K through 12 is where we can actually, we have lots of intervention, and we have kids, every day for 5 days a week. And so there's lots of opportunity to really infuse young people with hope and connection and resources and counseling and et cetera. But how are we connecting with our 50-plus-year-olds? And that's harder. And that's where our emphasis really needs to be. And that's what we're really trying to do in our program.
Thank you. Okay, Commissioner Savas?
Yeah, well, thanks for your presentation. It always, every time we have this, think about this in detail, just think about all, through my course of life, all the people that have taken their lives and, always wondering, why or how or whatnot. So, if all the advisory committee boards that I sit on, I'm assigned to, that I think where this topic comes up a lot and they're very passionate about is our veterans group. I know that PTSD, not limited to veterans, but PTSD is a big driver for some of those folks. So I just want to let you know that they are always been hungry. They've even, the former chair a couple of years ago, 3 years ago, came here and testified and seeking answers. And these people are really committed to helping their colleagues, comrades, through those tough times. I think the irony of the cell phone sometimes, or the internet, is that on one hand, I know a lot of people that is their social connection and the feeling of importance and connectivity, which is healthy to some degree. But I think that's all, I guess is how it's metered. But I think a lot of people might actually be more devastated if there was no connection like that. So, and I know our senior citizens also have that challenge as well for all the reasons you stated. So I appreciate the work. It's just brings up a lot of sad memories, unfortunately.
Absolutely, Commissioner Savas. Yes, and I'm sorry for your loss. It affects all of us on some level.
We've all experienced it. We've
Yeah.
all experienced it.
And conversations like this are, increasing awareness, but also bring up that kind of that tender spot for us. I do want to say the Veterans Advisory Council, we are working with them actively. They have voted to create a subcommittee. And Commissioner West, I think, are you the new VAC? Yeah.
This is the primary focus of their.
Yeah, so they just voted their last meeting to establish a mental health committee, which will work in conjunction with our Suicide Prevention Coalition to address the high rate of veteran suicide. We just learned that Oregon has the 4th highest rate of veteran suicide in the nation, folks. Oregon has the 4th highest rate in the nation. So, working with the VAC is something that we're really looking forward to because they are fired up and ready to go, and I'm really excited about working with them. And really, again, addressing kind of the 50-plus-year-old individuals, how are we connecting with those folks? How are we improving their sense of purpose and making them feel seen and that their life matters?
Just one little bit of shout out. The VAC I've never seen the VAC so organized. So shout out to all the VAC members and the staff that are helping them.
Shout out to the VAC members. I second that.
They're doing a great job right now.
Absolutely.
Just a couple comments, and first of all, thank you again for being here. And I was just kind of curious, Gally, we've worked together over the years. I've attended a number of your presentations and always learn something every time I have a chance to sit down with you. When was the last time you were here on this subject?
I was going to say I haven't presented for years, and it's been. I want to say it's probably been 3. I've been in this position for 10 years, and I think the last time I presented was pre-COVID. So I want to say it's been a minute. I know Commissioner Savas and Schrader, you've seen me present, but the rest of you, have not.
I think it would be great for us, maybe to have a discussion about really, I think it's keeping the conversation going to make sure that this is a topic of discussion. As I said, every time I hear you present, I learn something. And one of the things I wanted to ask you today to kind of talk about is if you are dealing with somebody who is just, say, for example, depressed, you're worried about them, they're hibernating, they're not getting out, and you actually had told me this once before, and I'm not sure if it's still a current practice, but I'd open it with, how you doing? And typical response is, I'm fine, right? And you had told me a long time ago, I asked this question, it's just like, hey, have you ever thought of hurting yourself? And I've been shocked at how many people say, yeah. And so, is that still a recommendation, and any kind of advice you could give to people viewing today or us, of if you have a loved one or somebody, kind of what would be the best way to approach that?
No, I appreciate that, and I love that you remembered that. That's great. That's great. Well, so first of all, Chair, what you're bringing up is, I'm just going to debunk a myth for those of you who may not know and people who might be listening or watching, is that asking about suicide does not put the idea in someone's head. So I want to just name that. There's this fear, right, that if I ask someone, are you having thoughts of suicide, people are going to, that person's going to get the idea and they may act on those thoughts. And what we know based on the research is that if someone has thoughts of suicide, they either have them in their head or they don't. We cannot, by asking them, are you having thoughts of suicide, does not put the idea or plant the idea in someone's head. So that's the first thing that I wanted to say, ask. The second part of what you're saying is that you're spot on, is that if you're worried about someone, and again, it doesn't have to be someone you know, right? It could be as simple as, hey, I know I've never met you before, but the way you're acting right now is just making me a little bit worried. And sometimes when people are acting this way, they're suffering so much that they're thinking about taking their life. Are you thinking about taking your life? Again, this isn't rocket science, folks. It's not that hard. What trips us up as human beings is we think, well, what if I ask the chair how he's doing and he says he's doing really lousy? Well, what do I do then? And that's where training comes in, right? That's why we've trained all these people in our community as a safety net. So we know if we can get people trained, then encouraging people to say, how are you doing? I'm worried about you. You seem like you're a little bit off. Are you having thoughts of suicide? If you say yes, then I'm more equipped to be able to handle that. And what we tell everyone is, you don't have to be a mental health professional to ask that question. What you do have to have is 988 in your head, or even better, our local crisis line in your cell phone. And people, you're never away from professional help. So if someone says, yes, I'm having a hard time, hey, let's call the crisis line together, and they can make a plan. And then the burden of figuring out what's next lies on the crisis worker. They ask the questions. You don't need to know. You could just say, hey, this person's acting a little bit funky. I'm not sure what's going on. Can you help us make a plan? The other thing that I will say, Chair, is that you said, are you thinking about hurting yourself? We need to make sure that we use the word suicide, that we use the word killing yourself. And as blunt as that sounds, people might think, well, I'm not thinking about hurting myself. In their head, they're thinking, I'm thinking about ending my life. So we need to be very clear about hurting self is very different than ending one's life. So using the word, are you thinking about ending your life? Are you thinking about killing yourself? Are you thinking about suicide? Are all very, very important, very direct questions. And we have training, we have QPR training that I would love. I know a long time ago we trained a lot of folks, including a bunch of folks at the Sheriff's Office when you were at the helm, Chair. So QPR is something that we would love to train you all in. It takes about an hour, and it talks about how do you have those conversations.
Right. Well, thank you very much. It's been wonderful to see you and hear
Great to see you, Chair.
how much of a difference you really make with so many people. And I think just kind of in closing, Andrew, maybe you can just put up the phone number so that folks can see that a little longer. And again, thank you very much.
Thank you, folks. Appreciate it.
Thanks. All right, there's our numbers. And the local crisis number that Gally was talking about. Gary, what is next?
Talk real slow so everyone can see the number on the screen.
Great.
503-655-8585.
One more time, please.
503-655-8585. It just rolls off your tongue.
And is
our-
there a person that answers
Yes,
24/7?
24/7.
Live person
A
is answering
live
the phone.
person, 24/7.
Are those county staff, or do we contract for that?
County staff during the day and contract overnight.
All right, we'll move on now. Next topic is new stabilization center name. Mary will also present on this. Go ahead, please, Mary.
Well, I am really excited to talk about the facility name, and it's actually, I hope, going to be pretty straightforward. So as you know, the Clackamas County Stabilization Center, which are two complementary programs, one a 23-hour crisis stabilization program with referral through law enforcement, our mobile crisis response teams, and the behavioral health units that are part of local PD. So somebody experiencing a mental health crisis, if we don't believe we can stabilize them in the community in lieu of jail or hospital, if the person voluntarily agrees, they can come to the stabilization center. They can stay up to 23 hours, 59 minutes, and 59 seconds. That's why it's called 23 hours, even though it is staffed 24/7. And then the complementary side of the program, other side of the program, is our housing and case management program, 13 beds. Folks will be referred through the Coordinated Housing Access Line who are unstably housed, and just need some stabilization and connection to services. So Claire Vita, a program out of Idaho that currently runs 12 stabilization centers, will be running the 23-hour side. And then the Father's Heart, a local agency you all know well, will be running the housing and case management stabilization. Your staff report says that construction is on track, and I'm happy to say, actually, the construction is done. They're out. The punch list is marked off, and so it's just ready to go. But we're here today really to talk about the name. And when we first started this project in 2023, pretty early on, we talked about and talked with individuals with lived experience around, do we call it what it is? Do we call it something different? It sits on McBroad Street, 9200 McBroad Street. Do we call it McBroad Stabilization Center? We definitely Googled to make sure there wasn't anything, concerning about the name McBroad. And really, we've consistently just called it Clackamas County Stabilization Center. And what people have said to us is, can you just call it what it is? To name it the Happy Place, I don't know if I'm talking to somebody what the Happy Place is, right? No one ever considered that as the name. But for example, so I'm here today to just, obviously you all can name the stabilization center whatever you would like. My recommendation is that we do call it what it is, the Clackamas County Stabilization Center. And really just, that way when we are trying to educate folks about why we would like them to go to the stabilization center and they show up and they see the door that says Clackamas County Stabilization Center, they know where they are where they need to be. So ultimately your guys' decision, but I am making that recommendation that we just actually call it what it is.
Thank you. Commissioner Savas.
Yeah, Chair, I'm happy to move that we name the facility at 9200 Southeast McBroad Avenue as the Clackamas County Stabilization Center.
Second.
Right. Commissioner Savas has moved to name the Clackamas facility located at 9200 Southeast McBroad Avenue as the Clackamas County Stabilization Center. Commissioner Helm has seconded. Further discussion? I see Commissioner West has a comment.
Really quick, if it's completed in October, why the opening all the way out in December if it's sitting there done?
Hiring.
Okay, so
Hiring and training.
we have to get hiring.
Yeah,
Okay.
Yeah. And we have to do the final sign off with the city. So there's still the building sign needs to be put up, some basic landscaping. So that gave us some window of time. So December will be the latest that we will start serving clients.
Okay, perfect. Thank you.
All right. Clerk, would you please call the poll?
Commissioner West.
Aye.
Commissioner Schrader.
Aye.
Commissioner Helm.
Aye.
Commissioner Savas.
Aye.
Mr. Chair.
Aye.
Motion passes 5-0, Mr. Chair.
Thank you. Gary, would you please introduce the next agenda?
Yes, thank you. Next, advisory board and commission appointments. Andrew, go ahead, please.
Mr. Chair, members of the board, the local Public Safety Coordinating Council, staffed by the Sheriff's Office, currently has one opening due to the incumbent's transition to Director of Health, Housing, and Human Services. As required by state law and council bylaws, the position must be filled by a mental health director. As the current director for behavioral health, the recommended appointee satisfies this requirement. The recommendation is as follows. Karen Kern to a first term on an ongoing basis. The board could select other candidates or require further recruitment, Mr. Chair.
Thank you. May I have a motion?
Chair, I move we appoint Karen Kern in her first term.
Second.
Right. Commissioner Schrader has moved to approve the appointment of Karen Kern to the Local Public Safety Coordinating Council. It's been seconded by Commissioner Schrader. Any further discussion? Seeing none, clerk, would you please call the poll?
Commissioner Helm,
Aye.
Commissioner West,
Aye.
Commissioner Schrader,
Aye.
Commissioner Savas,
Aye.
Mr. Chair.
Aye.
Motion passes 5-0, Mr. Chair.
Thank you. Gary, would you please introduce them
Yes,
next?
thank you. Next, Dog Services Charitable Fund Event Permission. Dan Johnson, Director of Transportation and Development, will present. There's a memo in your packet. He must seek your approval to do this per the code. Go ahead, Dan.
Good morning, Chair Roberts and Commissioners. Color Me Mine is a pottery studio. They want to do a fundraiser for the Dog Services Charitable Fund. According to statute, we have to have some authorization from the county director or elected official or trustee of the organization to authorize the use of the county's Dog Services logo associated with any kind of fundraising activity. Hence, we are here requesting authorization from for the board to give the chair authorization, once we have more information regarding the event, if it seems appropriate, for the chair to approve it. I'd be happy to answer any questions you might have.
Commissioner West.
So is this a franchise small business that wants to utilize their resources to help raise money for the dog
Yes.
services?
Essentially, they want to do animal-related pottery event that they want to sell tickets to.
Okay.
And they want to give a charitable fund a portion of the revenue raised from the ticket sales.
To the dog services. Okay, and I think we have one in Wilsonville that you have blank pottery pieces and you can paint on them and.
Yes.
Is that right?
Yep.
And then you can do your pottery designs and then they glaze them or whatever, you take it home.
Your awareness of pottery is really interesting to me, but yes, that is accurate to the best of my knowledge.
Okay, yeah, thank you.
Any other comments? Commissioner Helm.
So is this needed? I mean, are they partnering with us or are they just wanting to use our name to help promote the event?
They want to partner with us.
Partner with us.
Use our name, that they're raising funds for the charitable fund, Clackamas County Dog Services Charitable Fund. And as a part of that, then give us a portion of the revenue.
Do we know what that portion is?
No, I do not know that portion yet. That will be a part of the assessment we will do. And if we believe it to be appropriate and reasonable, we'll bring it back to the chair for authorization.
Because when I had a business and had events for charity, I just donated that money without, sometimes they were a surprise charity. It was, I don't know, it seems odd to do it this way.
So I can't even inform you right now if it's 100%, 90%, 80%. I mean, we didn't think it was worth the discussion with the entity until we got the authorization to go
All
forward.
right, so this is just authorization for.
It's just for consideration. If the chair wasn't comfortable or the board wasn't comfortable, we were just gonna, essentially go a different direction with it.
Okay.
Commissioner Savas.
Yeah, under those terms, I'm comfortable making the motion to authorize Color Me Mine to use the county's name and logo for fundraising purposes benefiting Dog Services Charitable Fund.
Second.
Commissioner Savas has moved to authorize Color Me Mine to use the county's name and/or logo for fundraising purposes benefiting Dog Services Charitable Fund. Commissioner Schrader has seconded that. Any further discussion? Seeing none, clerk, would you please call the poll?
Commissioner West,
Aye.
Commissioner Helm,
Aye.
Commissioner Schrader,
Aye.
Commissioner Savas,
Aye.
Mr. Chair.
Aye.
Motion passes 5-0, Mr. Chair.
Thank you so much.
Very much, Dan. Gary, what is next?
Thank you. Next is 2026 State Legislative Session Preview, including the special session update, revenue forecast, and preparing for 2026. Tony Holowetzky, Director of Public and Government Affairs, and Trent Wilson, Government Affairs Manager, will present. Go ahead, please.
Good morning, Commissioners. We're here to give you an informational update. First and foremost, around the recent revenue forecast and our preparations for the 2026 legislative session, short session. We're also hoping to provide an update, a final update on the special session around the transportation package, but that has been postponed, and Trent will provide more details on that as well. So I'm actually going to hand it over to Trent to provide you with the details on what we've learned about the forecast and some of the steps that we're taking to prepare for the legislative session. And so with that, Trent, I'm going to hand it to you.
Thank you very much. The revenue forecast for Oregon, at least for the rest of the biennium, is not amazing for the state level. As you've heard in recent revenue forecasts at the legislative level, the state budget is plateauing. It's starting to flatten out. It's been on the rise for over a decade, and so we've had legislature that has had a lot of money to work with to, build good things, fund bigger projects, fund programs and services. I think we're starting to look at, and this is the expectation being set by legislators, we're starting to look at a legislature that's going to have harder budget conversations. And that includes state agencies, that includes funding different projects. We wanted to share this with you as soon as possible because that money flows through different departments at the state level into the county services as well. So that will just make the 2026 legislative session that much more difficult, I think, to navigate. So we need to have some awareness of those things as we prepare to go into the legislative session. But that information is still forthcoming. This is a combination of the state's revenue income as jobs and economy numbers begin to sort of flatten out a little bit in Oregon. It's also a result of some of the actions that are happening in Washington, D.C. right now, specifically from H.R. 1 that was passed in July. And so that's changing, the cost of Medicaid and Medicare, and how that trickles into SNAP funding as well. That money gets circulated through the state, gets backfilled by the state. Some of that funding has to trickle up and down. And so those things combined are what are creating a complicated revenue forecast for the state. Right now, the state's looking at about an $800 million hole for this current biennium. They have about $500 or so million left that they did not approve in the long session this year. That was in anticipation of some of the federal turbulence that they were expecting. That turbulence seems to be coming to fruition. And so with that, they only have about $300 million that they are not able to fill with that expected $800 million gap, which means the state can expect to have about $300 million worth of cuts into the state programming. That's a big number. They have some options, such as they could dip into their reserves, or they can create new revenue. So those really are the two options that the legislature would have there. That's being communicated by the economists, by the state's economists, by legislators, by the Ways and Means Committee co-chairs. So just there's nothing for the county to do about it, but we wanted to bring it to your awareness so that you have that awareness going into session, part of our planning, part of how we think about the county and our budget. So that puts, a hard conversation on the work ahead. That's also next to the special session for the transportation funding, which is not concluded yet. They're expected to reconvene on Monday morning, and they sort of need to happen, for that to happen before the legislative days start, also on Monday afternoon. So those two things, I think there's some technical policy issues where those two things can't exist at the same time. Can't have a special session and an interim at the same time unless there's a policy thing I'm not aware of. So those are the big updates that we wanted to share with you. We are actively in PGA thinking about our approach to 2026. We're starting our meetings with departments now, and we'll meet with you individually soon enough. And you can see in our memo that we have some days that are on our minds. Legislative day is coming up here pretty soon, and just for your awareness, we have been given 30 minutes at the Joint Committee on Transportation to present information on the Sunrise Visiting Corridor project. So that's a great opportunity to share some of the success that are happening here at Clackamas County. That project was funded by the legislature in 2021, $4 million, and so this is a great opportunity for Clackamas County to go being transparent with what we've done with those state funds and show the good work that we've done here for a project that I think we believe can meet state goals if it's built, which is to build more housing, build more jobs, create more jobs, create, opportunities and good infrastructure for our fastest growing cities and our communities. So that's an excellent opportunity that we get to do next week. legislative concepts for the 2026 session. They're going to be due at the end of November. So if there's a bill that the county needs to push, we would want to have that conversation before that. And then we will talk to the board about our broader agenda. Sometime in December is our goal, but we don't have a date set. So we'll work with county administration on finding the appropriate date to meet with y'all to approve our agenda for 2026. Thank you.
Commissioner West.
Thank you. Thanks, Trent, for that update. It's no shock to me that the state does a great job chasing away taxpayers out of the state, and then they're shocked that they're not having the revenue that they expected. Is this a decrease of what they expected to get, or is this a decrease from like that baseline amount that of the budget, or is this just not getting the increase you expected in the next biennium?
I'm not an economist, and so I would struggle to answer that question. I take this as a revenue forecast. They're not expecting to receive this money that they're projecting.
So it's not necessarily, because you've had increase over 10 years and their budget has skyrocketed and ballooned. So this is just a decrease of their new expected desired amount, but not an actual decrease from the baseline that they've already received in the previous biennium. Is that correct?
Sorry if I'm misunderstanding your question. So they do these quarterly updates and they base it off of trends and, job losses and job gains and unemployment rates. It's a combination of a few different factors. But it is a forecast. So I think it's based on what they expect to receive, not what they expect to need.
Okay. Is there any honest conversation about reforms and austerity measures, which the state seems to never be interested in engaging in, but is always asking for taxpayers to pony up more in one of the highest cost of living states in the entire region, and we already have a high tax burden? The MO is we're just going to go back to the well again and ask for more from the turnip that has nothing left to give, but is there true conversations around reform and austerity measures, especially with the controversy around ODOT and the transportation package?
It's a good question. I can only offer my opinion on this one. Legislators are being very clear that anything and everything is on the table. So I think that ranges from revenue increases to cuts, right? And I think that historically the legislature has been apprehensive to dip into the rainy day fund. They don't like to do it. They are waiting for the big rainy days. And I don't know if this early phase of a cuts budget is where they want to take that risk. So I couldn't tell you one way or the other. I will say that the legislature that we have right now, the last cuts budget that the legislature experienced was 2011, 2010, and before. Not many of our current sitting legislators have been in cuts budgets. And so I think it's something that they are also trying to learn how to do. It could be rocky in a learning process there. It's just not that easy to do. And you have a lot of people who have been reliant on state funding, including through services and partnerships through services, county extension of services from the state. So I think it'll be rocky.
Do you have any forecast going into the short session because they don't do a ton of bills, or they're not supposed to. It's kind of supposed to be fixes. And we're going in kind of the nature of the short session is that it's short and they're not going to, they generally, this isn't always true, take on large pieces of legislation in that short amount of time. What are you getting a sense for what is the priority going into the short session? And what kind of fixes should we expect, moving forward?
The legislature meets for 35 days in the short session. Every House member is allowed one bill. Every Senate member is allowed 2 bills, to your point. Those are the big numbers, and the committees get a few bills. Tops out around about 300 or so bills total that can be introduced. So that's the range that I think that you were looking for there, compared to over 3,400 that were in the long session this year. The topic right now that we're hearing is that there isn't really appetite for a big, meaty topic in the short session. It's how do we navigate a $300 million funding hole. That will be the discussion. And if the transportation package is not able to get across the finish line next week, I suspect that could linger into the new year as well.
Okay, thank you for that.
Commissioner Savas.
Yeah, a comment and then a question. So it's not uncommon, any business owner, for example, worth their salt is always going to monitor what they think their forecasted revenues or sales are going to be and calculate that in being around as long as I have, we've seen the legislature be flush with a lot of revenue they didn't anticipate, and then also the hard times and recessions where they had to take it back. So it's not too hard to look at the quarterly payroll reports and surmise that, geez, payroll's down. So it's very trackable. It's usually pretty darn accurate, pretty reflective. To try to better understand the federal side of the cuts that are passed on to the state and, ultimately down to us at times. That's probably the harder one to actually nail down. So my guess is that, which this goes to my question, my guess is they'll probably roll into what they spend their time on the federal side, perhaps, to some degree. But do we, my question here is, we know it's an abbreviated session. It's only 30 some odd days long. I think Commissioner West already kind of asked the question, what do we think? But my question is, what is the typical amount of bills that are usually averagely succeed or pass through the short session?
Yeah, 20-ish% or so. Not quite 50.
Okay. That's still quite a lot. So still a lot of work ahead.
It's a wag, honestly, but that's what I can give you right now.
Like 100 bills.
I would say less. Probably like 70 to 80.
Okay.
That's all I have.
Right, thank you. All right, this has been informational only, so thank you both very much. We'll move on. Gary, what's next?
Thank you. Final item is Commissioner Communications, and you have a policy session at 11:30.
Right. Commissioners.
I don't have much to share, except I've been continuing to work with Oregon State University and the community college, and I just want to give a shout out to Nancy Bush for helping out with those conversations about co-locating at the OSU extension at the Clackamas Community College. That's really what I've been busy with.
Thank you, Martha. Commissioner Savas.
Yeah, it's just continuing to hear just local, local issues that are happening, nothing terribly significant. There's going to be tomorrow night, Tax Assessor Bronson Ruda is going to be presenting some tax information to the Oak Lodge Community Council. There have been conversations or I think some misunderstandings over the time as to taxes and where they come from and what they can be or not be. So that'll be interesting. I think he'll obviously do a great job and kind of clarify a few things. Historically, there's been this misunderstanding is one of the things he is addressing, fortunately. There's this misunderstanding out there that has circulated for years. I don't know if it comes from the League of Oregon Cities. We have two members here that were served on the city councils or so forth, but this somewhat misinformation or misunderstanding that the unincorporated folks don't pay their fair share or pay anything for the services they get. And every time I really looked into it and done a deep dive, most especially in my neighborhood, I found that's really not really true. But I'm going to give you a for instance. So the county tax rate for a city is the county taxes that the county collects is $2.40 some odd cents per thousand. And the unincorporated area is called rural unincorporated, but actually it means rural and urban. Anything unincorporated is under that same, it's $2.97 per thousand. So that delta is a 57 cents per thousand that the unincorporated residents or property owners pay, business or otherwise. More so than that. And that pays for planning and some of the things that cities do, that the county does. And on the city side, the cities pay for. So I'm always trying to help that myth or correct that myth, debunk that myth as to that. So he'll be addressing that. And also, I think some people think that that perhaps that $2.97 per thousand is something that they would be eligible for in its entirety if they were to become their own city. And that correction is no, actually, you will get 57 cents more, but your city tax rate standalone is more collected. So you don't get that whole $2.97. You only get 57 cents of that. And it's more, that's a simplified version of it, and he has far more detail. But anyhow, that's just a upcoming conversation. I intend to be there tomorrow night just to listen in and, fix a few things. But it's always an education to learn more about how those things happen and compression. And I don't know if he'll get into that level of detail. But Measure 5 and Measure 50 are something that constantly seem to be coming up at the local level and also at the state legislature. And I always caution everyone, if you're trying to reverse those or change those, and it has a significant impact on household incomes or taxes, that just be mindful that our constituents out there are struggling. There's a stat that just came out that, what is it, like 40% of households cannot afford a single $400 expense. I think that's the number, 35%.
35.
Just a $400 expense would put them in the red. They can't afford to absorb that kind of a hit. Unexpected car repair or unexpected appliance or whatever it may be in their household. So times are tough, and we had in my neighborhood, we had some of our neighbors got together and put together a garage sale weekend, and I was able to communicate with one of my neighbors and learned that they lost their job at Intel, by the way. So it's like, oh gosh. So the pressures are all around us, and there are layoffs out there, and I think there's some articles out there that can talk more about the layoffs. Just be mindful. The message here today is that I think families are struggling, and there are some layoffs, and not only are we feeling it, but the state legislature is going to feel it as well here. Chair, I yield back.
Great, thank you. And Commissioner West.
Yeah, thank you, Chair. Not much, but I'm excited that later this week, and I'll report back, I'll be going to the ONC quarterly board meeting and to talk about the ONC lands which Clackamas County has. It's a little complicated. I won't get into the policy, but it dates all the way back to the 19th century and railroad lands. But my goal is to help figure out policy with the current administration that allow those receipts to go and support our rural communities, and that we can have them actually have the resources necessary from the harvest of that timber to help them be more viable and economically stable, and communicating the need for that in DC and across the other western states who don't quite understand that unique timberland that we have in Oregon. ONC stands for Oregon and California, but all of the ONC lands are in Oregon, and specifically in the Willamette Valley. And they have to go with agreements that were made with local governments and the railroads that were put into the region and the area, and how to compensate for that and the timber. It's a complicated history. There is congressional statute tied to this. There is, it is a little topsy-turvy and windy, and a lot of things have happened throughout history. But we have ONC lands, and I hope that they can be as sustainable and productive as possible for our rural communities, and that we can gain those receipts. So I'm new to this policy discussion. It is fascinating, and I'm looking forward to going to a night in Lakeside, Oregon, to work with other state leaders and commissioners on this issue. And I will bring back what I learned from this board meeting, and that's what I have going on later this week, along with all the other county business. So, yeah, I will report back.
Thank you, Commissioner. Commissioner Helm?
Well, last Thursday, we were over on our meeting time, so we were shuttled out of here real fast before we could do our communications. But we did have our Grand Ronde visit on Wednesday. And I'll briefly just talk about that. It was absolutely fascinating, eye-opening, enlightening to go to Tumwata Village and see what's happening there. I won't go into that. I'll let you talk about it more, Chair. But I did go Wednesday evening to the Canby Fair Board meeting. That was my first attendance to that meeting as the liaison. Thursday, they were going to pour the concrete for the new building, which is over 44,000 square feet. seating for 2,300 people that can be separated into 3 different sections. That is considered concert style. They haven't gotten the numbers quite down yet for what it would be for conference style or what they call classroom format. But anyway, they were pretty excited about that. I learned a lot about the board and was just kind of able to introduce myself and talk to them for a while. It was nice. And then Thursday, the Three Creeks Protected Area Floodplain Enhancement Project had its groundbreaking. I was asked to speak to that because I was the chair of the West Advisory Committee for several years. This is an 89-acre site that just goes unseen by all of us because we drive by it literally every day, and it's going to be restored to its natural habitat and back to a true floodplain. So I'm pretty excited for that project to get started. So that was it for now.
Great. Just a quick follow-up on the Grand Ron, and I think we were all impressed, so across the board. And what I was really amazed at is just the history, which they really gave a long history of all the things that have happened over the years. I'm sure Dan can appreciate this as a project. Dan, they actually talked about a buried train car, and they had this ground-seeking radar to sonar, whatever it is, to identify tanks, and they were looking for it, and it turned out to be I thought it was a caboose, is the rumor I heard, but it was actually one of those tanker cars that has a tank on it that they buried. So it sounded like quite a project to remove it and the cleanup. So they said they have about 70% of the buildings torn down. A lot of the remaining buildings are huge. They say are more expensive, but I was just really impressed on the history and how they're trying to preserve some of the really old buildings in their portions of, just to make it. So very impressive. For the very first time I got to meet Cheryl Kennedy, the chair, and it was a nice opportunity. I know you've spoken with her before, Martha, and so the only other thing I had is just kind of a reminder for folks that on Wednesday, November 5th at Clackamas Community College, we're having the State of the County address. Want to make sure we're just telling individuals about that, and a chance for us to present on where the county's at and an opportunity to ask questions as well. So hope folks can make it on that. So with that being said, I'm going to turn to Gary as to what's next.
Thank you. Issues is completed. Next is your first and only policy session today. The topic is 2045 Transportation System Plan for Clackamas County, Project Introduction. This is an informational update only to begin the process of updating our transportation system plan. Staff from Transportation and Development will present. Please come on down, folks. Mike Besner, Assistant Director, and Karen Burek, Long Range Planning Manager. Go ahead, please.
Thanks. Hello. Chair Roberts, Commissioners, we are incredibly excited to be here to talk about an amazing project that we are embarking upon. It's actually one of the best transportation projects we can do where we don't actually build anything as a result of it. We are going to be updating our transportation system plan, which is basically the groundwork for what we intend to do for the next 20 years. This is the 2045 transportation system plan. Just let you think about that for a minute. It identifies our needs and priorities from a transportation perspective for a 20-year period. We also have to make sure we comply with all federal, state, and regional laws. There are quite a few, so we'll make sure we do that. The last one was adopted by the board about 10 years ago in 2014. And in that one, while collaborating with our Public Advisory Committee, we created 3 tiers of projects, Tier 1, Tier 2, and 3. And the intent was Tier 1 was basically a fiscally constrained list. It was the projects that we thought we could actually, over the 20-year period, have enough money to build. And Tier 2 was kind of the next one. Hey, if we get a little more than we think, maybe we can do some of these. And then 3 was the bulk of the projects where they're needed, but we actually didn't anticipate funding. So looking back on how we've done now that we're about halfway through that 20-year period, we've actually done quite a bit. In Tier 1, we have built or started about 36 projects, and a Tier 1 project would have been, one of them was a bridge on Canby-Markham Highway that we replaced, and the Stafford Childs intersection is a good example of another one that's underway right now. Tier 2, Redland Bradley intersection turn lanes, and then we also put an all-way stop at Haley and 282nd. So they're all very, very different in size and scope. Tier 3, we replaced a bridge on Porter Road, and we have funded now the construction of the Bull Run Bridge, which 10 years ago was a Tier 3 project. So Tier 1, it would guide what we tried to get money for most, but if we had a grant that showed up and said, wow, it applies real well to a Tier 2 or Tier 3, we would certainly do that. And that's the basis of how we use this plan. It's very practical. Also, when we get inquiries from the public, we're able to tell them, wow, that's not even on our list, please get involved, or we can tell them where it is priority-wise. We actually built or started about 40% of the number of projects that we thought we would originally. And so if we're halfway done and it was based on a very rough financial forecast and we figured we would have done 40 is not bad, especially considering, you know, the error in that and the way that inflation has hit in the last 5 years in the construction world. So I think the purpose of it from 10 years ago, we've done a good job in fulfilling it. And so moving on now to the update, I'm going to pass that on to Karen.
Super. Oh, me? Okay, perfect. Let's see. Hold on. Okay. Good morning, Commissioners, Chair. I am very excited to be here. I'm Karen Burig. I'm the Long Range Planning Manager. One thing I'd like to do, first of all, is just in the back of the room is Jeff Owen, and he's the project manager for this project. So he will be the face of the project, and I wanted to make that connection for you. So, Mike covered many of these different things that why we're doing this transportation system plan update. It has been about 10 years since a little over 10 years since we did it previously. But one of the things I really wanted to call out is that our transportation system plan is Chapter 5 of our comprehensive plan. And our comprehensive plan is a land use document that the board ultimately approves any amendments and changes to. So at the end of this very long process, we will be coming to you with all of the changes to our comprehensive plan and looking for your approval. So we're giving you a heads up now. And so a couple of very important changes that have happened over the last 10 years is that there have been changes to the transportation planning rule. That's the state guidance related to how we do our transportation planning. And so there's been a lot of changes there. There's also been an adoption. There's actually been 2 regional transportation plans that have been adopted. And the most recent one was the 2023 Regional Transportation Plan. Both of those documents guide the way that we do transportation system planning. So let's see, I'm sorry. So a piece and a central to this project is coordination. So this project is not just about the urban area or the rural area. We're looking at both urban and rural in the unincorporated spaces. But as you probably know, people, when they're on a road, they don't know if it's a city road or a county road, and sometimes there are county roads in cities and whatnot. So sometimes cities plan for roads outside of their jurisdictions. So we really need to make sure that we're working together with all of our cities, as well as ODOT. ODOT is a really important partner in this project because on our plans are projects that are expected on ODOT facilities, such as the interstate, such as the state highways. So they'll be central to this process. So a couple of other items that really need coordination. We know that we want to lead with safety, and so making sure that we're coordinating with other projects that are currently underway. And we want to make sure we're incorporating projects that have been completed in the last 10 years. We want to be able to spend the time to make sure we're addressing the unique aspects of the urban areas as well as the rural areas. And we want to look and see if we can identify strategies and actions that will help us reduce greenhouse gas emissions. So this is kind of an important slide. It's about the project schedule. We expect the project to take about 18 months, with the bulk of the work happening in 2026, as you can see. The project phases kind of basically give you the outline of the different steps needed to undertake this project. Now, while identifying important projects that we will need over the next 10 years is central to this project that we're doing, we'll also be talking about policies that impact how individual development occurs. We'll be talking about programs that support all of these different projects, and then we'll be talking about projects. So that's kind of the whole scope of that. We will be doing the project prioritization, similar to how we did it before and what Mike talked about, identifying the 3 different tiers and thinking about, first and foremost, what is, it's called a fiscally constrained list. What are those projects we think we can build within the next 20 years and really be able to use that to guide our prioritization. And then we'll think about, okay, we have all of these other projects we need to do, and what are those that might be unconstrained, and how do we put those in our kind of tier 2 and tier 3 lists. So another element that we're going to be doing through this process is creating a more user-friendly online document, because right now it's kind of hard to access. And then finally, I just wanted to call out on this timeline. As you can see, we're expecting this to happen between 2025 and ultimately in 2027 will be the adoption that I talked about, the changes to the comprehensive plan. But we hope to come back and coordinate with the board, provide kind of regular updates. And as you can see, it likely will be early next year as we've kind of concluded a lot of the existing conditions work. And then it would probably be really nice to touch base again in the summer as our prioritization process is kind of going full swing. Okay, so this is how we're going to do the project. And these are all the different people that are involved. Now, public engagement truly is central and will be impact all the different type of committees and people involved in the process. So we have a very extensive public engagement plan. It includes both the technical advisory committee, as you can see here, as well as a public advisory committee. There's also what we call geographic subareas. That's our ability to talk in a very kind of focused way with different geographic areas. People are more comfortable talking about the projects that are around their areas. So that will be a very important part of the project identification and prioritization process. They'll all be working with the project management team, and ultimately recommendations will go to the Planning Commission. They'll have their conversations, they'll provide a recommendation, and then they'll provide a recommendation to you. So a couple of ways that we're going to reach out to the community is we'll be attending different tabling events, doing pop-up events. We'll have online open houses. There'll be an in-person community workshops like I had talked about in the specific geographic areas. We've actually already started some of this work on public engagement, working with our public health team, kind of just to foundationally figure out how we can better connect with communities that haven't been involved in the past. So again, there'll be opportunities for us to come to the board to update you on the process. We'll also update the Planning Commission and potentially even the Clackamas County Coordinating Committee in that in the vein of coordination. So, looking ahead, or actually looking at what we're doing right now, is we're pulling together the Public Advisory Committee. The recruitment is fully underway, and it closes on September 29th, which is about a week away. In October, we anticipate coming back to you, returning to the board with a full PAC membership list. So during the last TSP process, we did actually have a member of the board as well as the member of the Planning Commission as ex officio non-voting members of the project, of a Project Advisory Committee. So when we come back in October, we may talk about that with you in further detail if that's something you're also interested in. So with that, that's a really high-level overview of a project that's going to be going on over the next 18 months, and we're here to answer any questions.
Commissioner Helm.
How many applications have you received?
It's my understanding we've received about 12, maybe 14.
And how many people are going to be on the committee? 12 or 14?
12 to 20.
12 to 20?
Yeah.
Okay.
And we really don't want it larger than 20.
Okay, all right, thank you.
Commissioner Savas.
Yeah. no response needed here. I just want to just share something. I was talking to one of our city council members here, and I think they had the mistaken impression that if a project's in the TSP or the RTP, or it's in the RTP and it's in their jurisdiction, that they're obligated to pay for it. So I know that if you wish to comment, you can, but it's accurate to say that not only are we doing our TSP, but everyone else are doing their TSPs, and all those TSPs combined together to the RTP, which is the metro region area. So projects that includes ODOT, that includes TriMet, others transit. So there's jurisdictions that are included in that bigger package. So can you remind me, Karen or Mike, how far after, I believe it was 2027, we adopt our TSP, how far after that is the RTP, the new RTP adopted?
So the Regional Transportation Plan is adopted every 3 years. Lucky us, just when we stop and we then start again. And so that adoption process actually should be around the same time, probably at the end of 2027. We are really shooting for the beginning of 2027 for our adoption, which would hopefully align nicely. And it's part of the reason why we're excited about getting this project underway.
And I will just add, these are plans. There's no obligation to spend money unless the jurisdiction chooses to.
Yeah,
Yeah.
exactly.
And I remember another counselor from another city in Clackamas County saying, gosh, there's 300 million or whatever it was in our TSP. We can't afford to do that. I'm not going to vote against the TSP. And I said, well, you're actually not obligated to pay for it. You have to do that responsible planning. And if you think of a project, if it's not in the queue, you're going to have a very hard time funding it if you don't put it in the TSP, whether it's a tiered or whatnot. So looking forward to that more robust conversation. And yeah, and what was again the total seats available on the committee is how many?
We're looking at somewhere between 12 and 20, depending on the number of applications we receive and kind of the balance. But we really don't want to go above 20 because that becomes a little unwieldy for a committee.
And we are continuing to push out, hey, we want people to want to do this, obviously. It is a better plan. Our last Public Advisory Committee was very strong, incredible array of people from our county, and it really served the process well. So we're going to do our best to get good applicants.
Yep. That's all I have, Chair.
All right, any other comments or questions? All right, again, this has been information only. Thank you for presenting today. So, Gary, unless you have anything else?
That's all.
All right, so on behalf of the Board of Commissioners, thank you all for joining us this morning, and we are adjourned.